Welcome to the deep dive. Today we're going to explore paraesophageal hernias.
Ooh.
And you might be thinking, hernia, isn't that when something pushes through your abdomen? Well, yeah, you're not wrong. But paraesophageal hernias are a bit more complex than that.
Yeah.
So we're using a medical document today called Paraesophageal Hernia, Clinical Features and Surgical Repair. And
Great source.
yeah, and we're going to be going through it and trying to understand what exactly a paraesophageal hernia is.
Sounds good.
So maybe we can just jump right in.
Yeah.
What is a paraesophageal hernia?
So basically imagine part of your stomach is pushing up through your diaphragm,
Okay.
that muscle that separates your chest and abdomen.
Mm-hmm.
And unlike the more common sliding hiatal hernias, this type involves a true hernia sac, meaning part of the stomach is actually poking into the chest cavity.
Okay, so it's not just a little bulge.
Right.
This sounds pretty serious.
Yeah.
What kind of symptoms would someone experience with this type of hernia?
Well, that's the tricky part. Most people with paraesophageal hernias don't have symptoms at all,
Right.
at least initially.
Wow.
It can be a bit of a silent time bomb, often discovered incidentally on a chest x-ray for something completely unrelated.
Wow, so someone could be walking around with part of their stomach in their chest
Yeah.
and not even know it.
Precisely.
That's unsettling.
But don't let the silent nature fool you.
Okay.
These hernias can lead to some serious complications if left untreated.
Like what kind of trouble can these hernias cause?
One of the most concerning complications is a gastric volvulus,
Okay.
where the stomach twists on itself.
Oh, wow.
This twisting can obstruct the stomach,
Okay.
cutting off blood flow.
Okay.
And that's an emergency situation.
So it's not just about discomfort.
Right.
This could actually be life-threatening.
Exactly. And then there's gastric outlet obstruction,
Okay.
where food can't leave the stomach properly. This can lead to nausea, vomiting, and significant pain.
Oh, God.
And in some cases, you can even have bleeding from ulcers or tissue damage.
So how do you even begin to diagnose something that often doesn't have any symptoms?
Well, as we mentioned, that accidental chest x-ray can be the first clue.
Right.
If a retrocardiac mass is seen, further investigation is needed.
Okay.
And that's usually when a barium swallow is ordered.
A barium swallow?
Yeah.
What's that?
So the patient drinks a special contrast solution, barium,
Okay.
which allows us to clearly see the outline of the esophagus and stomach on x-ray.
Interesting.
This helps confirm the hernia and shows us the anatomy of the stomach,
Right.
including any twisting that might have occurred.
So it's not just about seeing eye first there's a hernia,
Right.
but also understanding its structure and potential complications.
Exactly.
Well-
Another important diagnostic tool is an upper endoscopy,
Okay.
where a thin, flexible tube with a camera is inserted through the mouth and down into the esophagus and stomach.
Ah, so the doctor can actually see the hernia directly?
Exactly.
Wow.
This allows us to visually confirm the hernia, assess its severity, and look for any other issues like inflammation or ulcers.
Okay.
It's a crucial step in determining the best course of treatment.
So let's say a paraesophageal hernia has been diagnosed.
Okay.
What are the treatment options? Is it always surgery?
Not necessarily. If the hernia is small and not causing any symptoms, we might just monitor it closely.
Okay.
And if someone is experiencing GERD symptoms,
Right.
medications can help manage those.
Okay.
But surgery is often considered when medications aren't effective, when symptoms are severe,
Right.
or when emergencies like a gastric volvulus occur.
Okay, so surgery is a major consideration.
Yeah.
Can you walk us through what that would involve?
Of course.
Okay.
The goal of surgery is to return the herniated portion of the stomach back to its proper place in the abdomen, and then repair the defect in the diaphragm that allowed the hernia to occur in the first place.
Okay.
This is a delicate procedure that requires a skilled surgeon.
I imagine it's not just a simple stitch.
You're right.
Okay.
The first step is carefully dissecting the hernia sac,
Okay.
which is the membrane surrounding the herniated portion of the stomach.
Mm-hmm.
This requires meticulous precision to avoid damaging nearby structures.
Right.
Then the hiatal defect, that hole in the diaphragm, needs to be closed.
So they actually fixed the hole that allowed the stomach to push through.
Exactly.
Wow.
This can be done by stitching it closed
Okay.
or using mesh for larger defects.
Mesh, like
Yeah.
what they use for hernias in the abdomen.
Similar concept,
Go.
but tailored for the diaphragm.
Gotcha.
It helps provide extra support and reinforcement to the repair.
That makes sense. So they put the stomach back in place, fix the hole,
Right.
and then what? Are there any other steps involved?
Yes. Often a fundoplication is performed during the repair.
Fundaplication.
Yeah.
Okay, what's that?
This involves wrapping the upper part of the stomach around the lower part of the esophagus.
Creating a tighter valve to prevent reflux.
Ah, so they're addressing G or D at the same time.
Exactly.
Okay.
It's a common combination procedure to address both the hernia and any reflux issues.
Right.
And finally, they might perform an anterior gastropexy,
And what's that?
which involves securing the stomach to the abdominal wall to prevent it from sliding back up into the chest.
So it's like anchoring the stomach to keep it in its proper place.
A good analogy.
Okay.
And that, in a nutshell, is the surgical approach to repairing a paraesophageal hernia.
Well, that was a lot of information.
Yeah.
Surgery certainly sounds complex, but thankfully we have skilled surgeons who can handle these intricate procedures.
Absolutely.
Right?
But let's not forget about those who might not be candidates for traditional surgery.
Right.
There are alternative approaches for patients who might be too frail for a major operation.
Oh, right. I remember you mentioned that earlier. Can you
Yeah.
tell us more about that? Of
Yeah.
course. Okay. For these patients, we can sometimes use a less invasive procedure that combines laparoscopy and endoscopy.
Okay.
Imagine this. Using these minimally invasive techniques,
Mm-hmm.
we can actually reduce the hernia and secure the stomach in place
Mm.
using a double percutaneous endoscopic gastrostomy, or PEG, tube.
So instead of a large incision,
Right.
they're anchoring the stomach from the inside.
Precisely.
Wow.
This offers a less invasive option for patients who might not be able to tolerate a full-blown surgical repair.
That's incredible. It's amazing how medical science is constantly finding new ways to address these complex challenges.
It is.
Now, you mentioned earlier that surgery isn't always the answer,
Yeah.
and sometimes observation is a valid option.
Right.
How do doctors decide which path to take?
Well, it's a complex decision-making process
Sure.
that takes into account various factors, including the size of the hernia,
Yeah.
the severity of symptoms, the patient's overall health, and
Yeah.
their individual preferences.
So if it's small and not causing any problems, you
Yeah.
just gotta keep an eye on
Exactly.
Right.
Why put someone through surgery if it's not truly necessary?
it. Right.
But if the hernia is large,
Yeah.
causing symptoms,
Right.
or if there's a risk of serious complications,
Hmm.
then surgery becomes a more urgent consideration.
Okay.
And even then, the decision is made in close consultation with the patient,
Sure.
weighing the risks and benefits of surgery against those of observation.
It sounds like a very personalized approach.
Precisely.
So it's not just about following a set protocol,
Right.
but really tailoring the treatment to the individual.
Exactly.
Okay.
Now, speaking of individual factors,
Yeah.
one thing we always consider carefully is the patient's overall health and fitness for surgery.
Right, because major surgery can be tough on anyone,
Absolutely.
especially for someone who might have other health issues.
Exactly.
Wow.
That's why we use a scoring system
Okay.
called the American Society of Anesthesiologists Physical Status Classification System. Oh my gosh.
Or ASA score for short.
Okay, an ASA score.
Yeah.
What is that?
It helps us assess a patient's fitness for surgery,
Okay.
taking into account things like their age,
Right.
pre-existing conditions,
Mm-hmm.
and overall health.
So a higher ASA score would mean a higher risk during surgery?
In general, yes.
Correct.
Patients with higher ASA scores tend to have a higher risk of complications,
Right.
although not necessarily a higher risk of mortality.
Okay.
It's just another piece of the puzzle that helps us make informed decisions about treatment.
So it sounds like understanding your ASA score
Yeah,
could be helpful in having these conversations with your doctor
absolutely.
about treatment options.
It's all about empowering patients to actively participate in their healthcare decisions.
Right.
And speaking of informed decisions,
Okay.
let's delve a little deeper into the surgical options themselves.
Great. I'm curious about the different surgical approaches.
Yeah.
I know you mentioned laparoscopic and open surgery.
Right.
Can you explain the difference? Of course.
Okay.
Laparoscopic surgery is a minimally invasive technique.
Okay.
We use small incisions and a camera to guide the instruments,
Okay.
which allows for less pain, quicker recovery, and smaller scars.
All right.
Open surgery, on the other hand,
Right.
involves a larger incision to directly access the hernia.
So laparoscopic is generally preferred.
Yes, in most cases,
Okay.
but there are situations where open surgery might be necessary,
Yeah.
such as if the hernia is very large,
Mm-hmm.
if there's a lot of scar tissue from previous surgeries,
Okay.
or if there are other complicating factors.
So there's no one-size-fits-all approach.
Exactly.
Right.
The surgeon will carefully consider all the factors involved
Okay.
and choose the approach that offers the best chance of a successful outcome for the individual patient.
Now, you also mentioned using mesh to reinforce the repair.
Yes.
Is that always necessary?
Not always, but it's often used,
Oh, yeah.
especially for larger hernias.
Okay.
Mesh helps strengthen the repair and reduce the risk of recurrence.
But I've heard that mesh can sometimes cause problems.
That's true.
Like what?
There can be complications with mesh,
Okay.
such as erosion or infection.
Hmm.
That's why we carefully weigh the risks and benefits before using it.
Right.
And we always discuss these potential risks with the patient beforehand.
So it's a balancing act.
Yeah.
Mesh can help strengthen the repair,
Right.
but there are potential downsides to consider as well.
Exactly.
Okay.
And this is another area where ongoing research is important.
Mm-hmm.
We're constantly learning more about the long-term outcomes of using mesh.
Right.
And this knowledge helps us make better decisions for our patients.
Now let's shift gears a bit and talk about recovery after surgery.
Okay.
What can a patient expect in those first few days?
Well, the first priority is to make sure there are no leaks
Right.
and that the repair is holding up.
Okay.
So the patient will have a barium swallow on the first postoperative day.
That familiar barium drink again?
Exactly. It allows us to check for any leaks and ensure the stomach is emptying properly.
Mm.
Then the patient will start with clear liquids
Okay.
and gradually progress to a soft diet as tolerated.
Okay, so no steak and potatoes right away.
Not quite,
Oh, yeah.
but a gradual return to a normal diet is usually possible within a few weeks.
That makes sense.
Yeah.
Now, one thing that comes to mind is the possibility of recurrence.
Sure.
Can a paraesophageal hernia come back even after surgery?
Unfortunately, yes.
Okay.
Recurrence is a possibility even with the best techniques and most experienced surgeons.
Right.
The rates of recurrence vary depending on several factors, but it's something we always keep in mind.
So what can someone do to minimize the risk of recurrence?
Well, maintaining a healthy weight,
Okay.
avoiding smoking,
Mm-hmm.
and managing conditions like chronic cough or constipation can all help reduce stress on the diaphragm
Okay.
and lower the risk of recurrence.
Okay.
And of course, attending follow-up appointments and reporting any new or concerning symptoms is crucial.
So it's about taking a proactive approach to health and being vigilant.
Exactly. It's a partnership between the patient and the healthcare team.
Well, this has been incredibly insightful.
It's been my pleasure.
We've covered a lot of ground today.
We have.
From the basics of paraesophageal hernias
Mm-hmm.
to the intricacies of surgical repair and beyond.
Yeah.
But before we wrap up, I have one final question for you.
Okay.
Knowing what we know now about the potential for recurrence and the complexities involved,
Right.
what advice would you give to someone who has just been diagnosed with a paraesophageal hernia?
I would say, first and foremost, don't panic.
Okay.
It's a serious condition, but it's manageable.
Right.
We have effective treatments available.
Mm.
It's important to gather information,
Okay.
understand your options,
Right.
and find a healthcare provider you trust to guide you through the process.
Knowledge is power, as they say.
Absolutely.
Right.
And don't be afraid to ask questions.
Mm-hmm.
The more you understand about your condition, the better equipped you'll be to make informed decisions about your care.
And I imagine finding a surgeon experienced in paraesophageal hernia repair is crucial.
Absolutely. This
Yeah.
is a specialized area of surgery,
Right.
and experience matters.
Yeah.
Don't hesitate to seek a second opinion
Mhm.
or consult with a surgeon who has a strong track record in this type of procedure.
It's your health, after all.
Right.
You deserve the best possible care.
Absolutely.
Now, let's talk about something that wasn't explicitly covered in our source material today.
Okay.
But it's something I think is important for our listeners to consider.
Yeah.
The emotional aspect of this diagnosis.
Right.
Dealing with a hernia, especially one that might require surgery, can be stressful,
Sure.
anxiety-provoking.
Absolutely.
Any advice on how to cope with those feelings?
That's a great point.
Yeah.
And it's something we often discuss with our patients.
Mhm.
It's perfectly normal to feel anxious or overwhelmed.
Right.
My advice would be to reach out for support. Talk to your loved ones,
Mm-hmm.
connect with support groups,
Okay.
or seek professional guidance from a therapist or counselor.
Right.
Remember, you don't have to go through this alone.
So it's not just about the physical healing,
Right.
but also the emotional well-being.
Exactly.
Okay.
Addressing both aspects is crucial for a full recovery.
Mm-hmm.
And remember, knowledge and understanding can go a long way in reducing anxiety.
Right.
The more you learn about your condition and the available treatments,
Right.
the more empowered you'll feel to make the best choices for your health.
Well, on that note,
Yeah.
we've reached the end of our deep dive into the world of paraesophageal hernias.
We have.
We covered a lot of ground today,
Yeah, we did.
exploring the intricacies of this condition from diagnosis to treatment and beyond.
Absolutely.
We hope this deep dive has provided you with a solid foundation of knowledge
Yeah.
and empowered you to navigate this complex topic with confidence.
Exactly.
As always, we encourage you to delve deeper into the source material, the full medical document,
Right.
and to consult with your healthcare provider for personalized guidance.
Absolutely.
And remember, while paraesophageal hernias can present significant challenges,
Right.
early detection,
Yeah.
timely intervention,
Mm-hmm.
and a proactive approach to your health can make all the difference.
I agree.
That's a wrap on our paraesophageal hernia deep dive.
It was fun.
Until next time, stay curious, keep learning, and take good care of yourselves.